Covering up, now a precaution health experts are recommending. It does not have to be an actual mask.
Over my nose, over my mouth, do the best you can.
That's the idea, and it can be homemade. The Surgeon General with a video how to do it. I made one myself. I used an old pillowcase to make my mask. Now, don't worry about the edges. They don't have to be neat. You're going to fold this up, and you just fold the sides in from the bottom and the top, and then do it again. And I'm just using hair ties that I had laying around my house to put those over the sides on each side, and then you fold in each side, pull the hair bands, and then the hair bands, that's what goes over your ears.
If you ask me, if you call as a patient and ask me, I would tell you, whatever you have available, you want to try to get the thing that you can least see through.
You may have questions too, so we went to the chair of family and community medicine at Temple University. How should they fit so that they work well and also so that you can still breathe?
So I think the most important thing for us to remember is that if you're not covering your nose and your mouth, you're losing out on a lot of the benefit.
She also says we should wash them after each use. If you're going to be making one of those homemade masks, is it safe for children to be wearing them?
So I think it depends on the age of your child. In general, anyone that's 2 years or younger, you don't want to put a face mask directly on them. We worry about them not being able to get enough air and feeling a little bit smothered.
Dr. Savoy says they're okay for older children, and there are some other precautions to keep in mind.
My recommendation for my patients has been, if you've got asthma or COPD or some other lung disease, honestly, call someone else in your family and have them go run the errands for you. I really don't know that we need to be taking unnecessary risks unless there's just you and you're the only option.
For those of us who do have to go out, when should you wear a face covering? Grocery stores, pharmacies, trains, anywhere where you might get in that 6 feet distance of someone. But the biggest thing to remember.
So the most important thing is for people to still stay home.
Yeah, that's the message she really wanted us to remember. Now, I wore my mask that I made to the grocery store this weekend, and I noticed, because it took a little while, after a while it was a little bit difficult to breathe. So I asked Dr. Savoy about that. She said her advice is get in and out as quickly as possible, and if you do start to feel a little lightheaded or dizzy, slow down.